Performance Management for Physicians in the U.S. Learning Objectives. The learning objectives that I learned while writing this case write-up is the pay-for-performance method, initial effect, and how the performance management function improved the incentive plan. Next, I learned the link between performance management and the value-based incentive program of pay for performance. What I want the audience to learn is the emphasis on specializing the pay for performance method for it to be successful. Next, how the monetary rewards of these incentive programs can be damaging to physicians' professional identity. Lastly, how the healthcare physicians feel about the value-based payment method. Performance management. The purpose and function of performance management is to set performance goals, monitor progress, creating strategies to improve, feedback, and training. Performance management improves performance for all employees and makes decisions on how to reward or discipline. In a hospital/physician group, it is a comprehensive system that enforces goal alignment, education and training, honest communication, and more. The rewards are necessary for retaining top performers and encouraging others to improve performance, which influences patient quality experience. The link between quality performance and compensation has led to the discussion for pay per performance method growing in popularity. Case challenge. A poll done to get the viewpoint from physicians on the pay per performance method had a variety of results. The various feelings towards the payment method led to uncertainty and wariness. Collectively, throughout the poll, the physicians agreed that they are rewarded for meeting their goals and that the rewards do increase quality performance. However, that does not decrease the number of medical mistakes. The payment method also brings challenges of its own. The method causes rifts between physicians and demoralizes physicians who do not meet their goals. In another scholarly journal, Professionalism, Performance, and the Future Physician Incentive say that physicians see the method to be manipulative, burdensome, and discordant with their professional identity. The use of monetary rewards to meet their goals fails to understand physicians' professionalism, and it does not focus on what motivates most physicians, which would be autonomy, mastery, and purpose. Case solution. A project done by Fairview Health Services say that the incentive for the extra compensation had the best results with the lowest performing physicians. They improved on average 3 times more than the middle performing group and 6 times more than the top performing group. They go on to say that the concerns about the unhealthy competition were non-existent due to increased in collaboration with clinicians because they were forced to work together to enhance clinic-wide performance. Behavioral economist Dan Arley said that the organization needs to be aware and personalize its pay for performance method with its current challenges, whether it be lack of knowledge, motivation, or resources. He goes on to say that a thoughtful design of pay for performance method is key to its success. Case solution and approach. Going back to the other scholarly journal, Professionalism, Performance, and the Future Physician Incentives, say that the current design of the pay for performance method offends physicians' professional identity and is insulting by providing tips for goodwill and professionalism. However, it does not capitalize on physician professionalism. The future performance incentive program should include non-financial incentives such as rewards and recognition, resources for quality improvement, and quality and care investment. Instead of individual incentives, there should be team-based rewards. And instead of management-based evaluation, it should be constantly evolving and having locally determined targets. Lastly, it should emphasize on local culture and organization responsibility instead of centralized accountability on physicians. Conclusion. The payment method evolved exactly the way performance management is carried out in the real world. For one, it sets a broad performance goal with physicians, meeting a benchmark and receiving a reward. Next, the monitoring and progression of this incentive method. Thirdly, the organizations and others created strategies to support the improvements of the payment method. And lastly, with a given feedback, it evolved and achieved its goal in providing better quality care. An unexpected outcome of the pay-for-performance plan helped the expensive cost of asthma. With a total cost of $20 billion, it was used throughout a large variety of health services, and it improved clinical outcomes and reduced the cost of asthma. Performance management is a constant function, and with its relativity into the healthcare setting, a future study should be done on the pay-for-performance method on whether it should be more focused on specific chronic diseases or certain costly medical expenses. If the future study shows promise, it can positively impact the incentive program rather than the opposing viewpoint of paying for expected quality care. Thank you.